Hello, my name is John Heitner. I'm Division of Cardiology in the Department of Medicine at York Methodist Hospital. This morning I'd like to give you a tour of the Division of Cardiology, and so I'd like to welcome everybody. This is where the Division of our Cardiology scheduling area is, and this is really where the forefront of when patients come in, this is what they generally see. There's always somebody here to greet our patients as they come through off the elevator into the entire division. And we have some excellent staff members, speak Russian, Italian, Spanish. This is where really the face of cardiology. So now we are going to head over to our non-invasive section of cardiology, where we happen to do our echocardiography, our non-invasive cardiology such as nuclear and stress testing. This is where we do our exercise stress testing. We have one of our patients here, and Debbie Rinaldi, who's our supervisor. She's in charge of our non-invasive stress testing area. She's been, Debbie, how long have you been at Methodist Hospital for?
April 2011 will make 20 years.
20 years. So she's probably actually one of the oldest as far as time being at New York Methodist. And here we are at our reading room, which is where we read our echocardiography, our nuclear cardiology. And the growth of this has actually been quite tremendous over the leadership with Dr. Sacchi. We've gone from doing roughly around 3,000 echoes a year to over 10,000 echocardiographies a year. And we do about 2,000 nuclear stress tests as well. So this is where many of us spend a large number of hours. Dr. Saul happens to be one of our oldest tenured faculty, came to Methodist Hospital since 1991. So he's seen a tremendous amount of changes here over the years. Dr. Saul, if you'd like to say a few words.
Certainly, yes. Methodist, especially the cardiology division, has grown dramatically over the last 19 years. We now are able to take care of all problems that people have with their heart, and we're constantly building and expanding and using all the latest techniques. Anyone needs their heart taken care of, this is the place to come to.
Brooklyn is a tremendously diverse cultural borough, and so we try to meet the needs by having a wide diversity of both employees and faculty members as well. One of the other aspects from the cardiology that I'd like to bring up is our educational area. We started a cardiology fellowship in 2005, and we've actually grown from 3 fellows to 13 fellows. And this is something we take tremendous amount of pride in, education of the young physicians. So that's been a benefit to the hospital and to the community. One of the more important aspects, as well as our education, is our clinical research. We have about 8 or so multi-center trials that are nationally driven, some sponsored by the National Institute of Health, others by the Duke Clinical Research Institute. We're walking into our Cardiovascular MRI Center. This happens to be really the only dedicated cardiovascular MRI center throughout Brooklyn, Staten Island, and most of Queens as well. Cardiovascular MRI is a relatively new field in cardiology. It's been really ongoing for about 10 years. This is where I actually have my specialty. I trained under Ray Kim and Bob Judd at Duke University, who happen to be the pioneers in the field. And here you can see the MRI right there. One of the newest and innovative cardiovascular MRIs. One of the great aspects of the Cardiovascular MRI Center is that everything is internet-based. So we can send a patient's images to the cardiologist or the primary doctor who referred the patient. And so you get beautiful images. Really, it's just a machine and technology that has allowed us to really open up entirely new aspects of imaging to the heart. Something that Methodist is really in the forefront in both Brooklyn and New York. So we're going to walk over to the invasive section. This is where we do our procedures such as electrophysiology, our interventional procedures that we put stents and balloons in people's hearts. So I'd like to introduce our electrophysiology department. This is Dr. Joya Torito. Dr. Torito has been with Methodist for about 7 years. We're very lucky, actually, from a hospital standpoint, to have Dr. Torito. She's a world-renowned electrophysiologist, an expert in ablations, and has recently started the atrial fibrillation ablation, which is a very difficult technique that is one of the few places in Brooklyn to actually be able to do this?
Right now we are going to start an ablation procedure. This patient presented with complaints of recurrent palpitations that were very severe and limited his quality of life. What we are going to do is introduce electrical wires into the heart, map the electrical system. I'll show you how we do it based on a previous exam. This is a color map. It's like a GPS. Our catheters allow us to reconstruct a map of the patient's heart that shows with different colors according to the area where the electrical activity starts first and ends last. So in this case, for instance, we were able to locate the source of the problem in this yellow area, and we successfully delivered the radiofrequency energy, which is a form of energy that suppresses electrical activity. And we are very confident that the patient won't experience any recurrence of his irregular heartbeat.
In addition to Dr. Torito, we have Dr. David Benson, who is also part of the electrophysiology staff and has done a fantastic job building the program.
We're very proud of the growth of our EP division over the past several years. We've expanded into full service with full complement of devices, pacemakers, defibrillators, resynchronization devices, as well as a full complement of ablations. We're very proud of our staff, and we think we provide a good service.
Here we are at one of our interventional labs. We have Dr. Sacchi, Terrence Sacchi, who's the chief of cardiology, is currently performing an angioplasty, looks like, on one of the New York Methodist patients. So it's been a tremendous amount of growth over the years under Dr. Sacchi's leadership. He remains one of the premier interventional cardiologists in the Brooklyn area. Methodist, I think, is very lucky to have him.
You know, I think it's an extraordinary group of people that have been assembled. The hospital has really been very supportive in a relatively brief time to allow us to build what I think is an excellent division of cardiology. And with our Department of Cardiac Surgery, I think we have an excellent, high quality, attentive to detail, excellent educational program, care of patient program. We're very excited about what we've done and, more importantly, where we're going in the future.
Recently, Dr. Sacchi brought on Dr. Soren Brenner from Cleveland Clinic to direct the interventional cardiology lab. Dr. Brenner is really one of the world-renowned interventional cardiologists and has a tremendous amount of knowledge and skills in interventional. And together they really, I would say, form a dynamic duo for the interventional cardiology program. And they've really raised Methodist Hospital to become the #1 center for interventional cardiology and for cardiology as a whole.